Well, everybody, health is a critical component for life. If you're not healthy, then what do you have? At least they always say, at least you have your health. Well, ladies and gentlemen, welcome my good friend Dr. Mike Munro in the building here today. Dr. Mike, what is it like being somebody who specializes in helping people to be healthy?
Well, it's absolutely fantastic. It's something that I really didn't know I wanted to do early on. I started out after college in the nutrition business simply because my dad, worked in it and he got me in there. And then I found out, that it was something that was, it was exciting. It was interesting. It was so much. It was so much learning. But that brought me into, pursuing the chiropractic career, and it's just I've had some just amazing experiences since I've been a chiropractor.
Well, with that, ladies and gentlemen, warm welcome to Dr. Mike Munro. Mike and I have been friends for since our 20s, so that's at least 5 or 7 years now.
Yeah.
We're in our late 20s by now.
Thanks for not dating us.
But we're getting up there, but we stay in good shape, and Dr. Mike is an expert. With that, we give a shout out to our awesome supporters we have for our show here. So take a look on the wall behind me here. You can see Carroll House Furniture. Brooke Dubman there, Amy. Carroll House is awesome to have them as a sponsor and helping us support what we do here, because without them, we obviously would not be able to get all this done. And with that, we do appreciate their support. And then, of course, our big sponsor also, USA Mortgage, powered by the Flowers team. There they are. Steve Flowers. Work with those guys daily. We're closing a loan later tomorrow afternoon for one of our constituents and helping them to get that done. But I'm a licensed loan officer too, so keep in touch with us for any needs you need for the in the mortgage world, because they literally do allow you to get, this market is kind of crazy right now, but everybody needs to get a mortgage if they're going to be able to get into a house, right? That's what you do with your homes these days. The mortgage is obviously what everybody goes with. With that, I'm going to put on the TV wall then Mike's website, Dr. Mike Munro, primarycarechiro.com. Good looking website, Mike.
Thank you.
So tell me, what was the path? What was it? You talked a little bit about your dad and the background you had, and then you got into chiropractic. You went actually to what college, chiropractic college did you go to?
I went to Parker Chiropractic in Dallas, Texas.
Dallas, Texas. And I know you had a background with not the pharmaceutical side, but the nutritional side for a long time, and really helping people understand how important vitamins were. And that kind of led to where you're at now. You've got some really in-depth. You've given me an analysis. Boy, you can tell everything that's going on with somebody's body. Tell us a little more about that background and that path you had to get here.
Well, of course, I started out in nutrition, and I knew nothing about it when I started out. And I learned from some excellent mentors. I call them mentors now. They've kind of guided me along my career path. And what the biggest thing I found out is that nutrition, or vitamins and minerals, the supplements, they exemplify function. And that's what we're looking for when it comes to health. So many people do not understand the true definition of health. I mean, if you even Google it these days, and you get things like absence of symptoms, absence of illness, absence of disease, feeling well, that's a good one. That's not health. I mean, people, if you're reading in the news today, and that people dropping dead, of heart attacks, 30-year-old athletes, it's like, but everybody says they were healthy. Well, if you look at absence of disease, absence of illness, absence of symptoms, I guess, they were healthy. But you have to look at function. How the body functions is a determinant of health today, and that's what we look at it in our office. We look at function versus non-function, right? So if things aren't functioning correctly, then there's prone to be symptoms and diseases and illnesses. There doesn't have to be. So there's a lot of things that can happen, that doesn't cause symptoms, but you can be dysfunctioning. So that's what we try and look for, and we do that by running lab tests and other computerized health scans and testing different functionality of muscles, and we can come and see, how the whole body is functioning.
Well, that's a very important component with regard to if you're going to get the whole body healthy, then I would say it's probably very important that you have your whole body scan checked, that every component of it is in. There's so many systems we have in our body that interact and interoperate that make this very complicated. And so often it seems that we've talked about this in the past. You and I talked about it. Some of my good friends, they're chiropractors too. There's so much treatment for the symptoms, but they're not actually treating the problem. And that's what you're really focusing on. And that really, why cover something up only to keep it as an issue that's continuing? Fix the problem, right? Is that a better way to address these issues?
That is the only way to address the issues. Otherwise, if you're treating symptoms, you're masking symptoms and you're causing up more symptoms to come. And then, I mean, it's just it's a chain, and you don't want to go there. But why not identify the cause of the problem, right? The cause of the diagnosis, right? And go from there. You know, I mean, treat the cause. The cause is what's causing the dysfunction, right? To give you an example, I see a lot of people with digestive dysfunction, and they could have symptoms. They could have minimal symptoms as far as digestive issues like heartburn and reflux and bloating after they eat, or constipation, diarrhea, kind of thing. Those could be symptoms. They could not. They might have just one of those symptoms, right? So they think, and they live with it. So they think there's not a big problem, right? But then they go finally, you know, it leads into worse symptoms, and then they finally go get checked out, and usually it's something, you know, bigger at that point, a bigger diagnosis, a bigger problem, right? Whereas if you use the symptoms, or even no symptoms at all, just go and get a routine check from time to time. And in fact, the older you get, you should go get those more routinely. I mean, we go get our teeth cleaned every 6 months and get them checked. We take better care of our cars than we do our bodies sometimes. You know, we go get our oil changed every 6 months or every 3,000, 5,000 miles, whatever. But when it comes to our whole body, our whole system, we don't get that checked up. We wait until we have symptoms and problems, and then we go to a doctor. And by that time, you know, they're using surgery or drugs to take care of the symptoms, and they don't check for the cause or the dysfunction of the body.
Tell me a little bit more about what is the difference versus other chiropractors, what you do. There's a lot of chiropractors out there. They do some incredible work, very important what they do, because the chiropractic angle, I think, is much more efficient many times than actually dealing with the problem. But now there's become niches, specialties. And talk a little bit about your specialty and what some of the differences are between your different types of chiropractic doctors.
First of all, I mean, you can't go wrong with seeing a chiropractor. I mean, chiropractic has been around since 1895, and has done some wonderful, just tremendous things for the health of humans and animals, for that part. But you know, chiropractic still is basically structurally driven, and I say basically because we do deal with the nervous system when it comes to the chiropractic adjustment, and it does have effects chemically, emotionally, and this isn't. There are more studies that are backing this right now. So I don't want to get, you know, ahead of myself or say anything that's not true, but it has been proven clinically, definitely, that the chiropractic adjustment has affected things biochemically in our bodies. So getting adjusted structurally by a chiropractor, the chiropractic adjustment, does wonders for whole body health. But then there are, like you said, specialties, right? The chiropractic profession is no different than the medical profession. The medical profession has ears, eyes, nose, throat doctors. They have endocrinologists. They have gastroenterologists. They have specialty fields, right? So chiropractors do also. Now, I mean, there's sports medicine doctors. There's your what I am is a chiropractic internist, right? So I have over 300 hours in the specific diagnosis and treatment of internal disorders, right? So I kind of do the same things, run the same labs, do the same tests as a gastroenterologist or an endocrinologist would, to see what's going on with a person when they come in for a checkup or a problem or issues.
Well, that seems like there's a lot there. Is there some overlap, if you would, to say that when you're diagnosing the body and the issues that are going on, doctors are running, like you said, very similar tests to what you run. It's just a matter then how do you treat it after you've diagnosed the problem. A lot of people would say, oh, well, there's some medication that can be used for that, right? There's some kind of a pill you can take. And now we've got people that are lined up and they've got 7 or 10 or 15 or 50 pills they've got to take daily or weekly or monthly. But is that really the best route to protect us? When you talk about the way the body is, it's one giant system, and I guess the spine, the nervous system has a lot to do with most of all that. How does that interact, and how should people be more enlightened with regard to how that can create better health for themselves?
You made a lot of points there. So let's start with, yes, the treatment is basically the biggest difference between a doctor of chiropractic and a medical doctor, right? Doctors of chiropractic don't do anything invasive. We don't do anything where we cut into the body or give it chemicals, pharmaceuticals that cause side effects. So everything, instead of surgeries, we'll do the chiropractic adjustment, which is manipulation, right? Non-invasive. Instead of pharmaceutical drugs, we'll use natural vitamins, minerals, herbs, amino acids, enzymes, right? Stuff that increases function as opposed to decreasing function. If you look at how pharmaceuticals work, they all go to block, inhibit, stop a naturally occurring function in your body, usually blocking an enzyme or a receptor site, something of that nature, right? To get to where they want to go, biochemically speaking. Vitamins and minerals are cofactors of these enzymes, so we can increase the function, right, through the correct supplements, vitamins and minerals, as opposed to stopping or inhibiting the function. So yes, we go about treating differently than the medical profession, but we arrive at the diagnosis in the same way. We do the same lab tests and we do the same urine tests, and we run all those to see what's going on with people.
Well, it seems that a lot of people do not understand the full function of what chiropractors provide, and when you get down to it, it just seems so much more in depth. When I go to a normal doctor, rarely do I hear them talk about enzymes. You mentioned a couple of terms there, but with regard, enzymes are going to be something that obviously are in depth in managing conducting our system so that we can produce everything we need for our body to function. But they don't even talk about that when I go to a normal doctor. They're just saying, here's something you've got wrong. Here's something that will fix the problem. And it doesn't really actually fix the problem. It's covering it up. And I guess that's where I feel like there's so much more that chiropractors address directly to solve the issues and make them better. Is that true? Is that a difference there? Explain that for me a little bit, if you would.
Well, I've heard some stories from some of the patients that I've had. The number one thing they say is just the medical profession doesn't talk anymore. They don't talk to them. They see a patient every 5 minutes, and I don't know if this is true or not. I mean, this is what I'm getting from my patients, because the first visit that I see somebody, I want to know everything about them, and we talk, and the average time I spend with them is an hour, the first visit, right? That's unheard of from what I've heard of in the medical community. They don't spend that amount of time with people. But I get to know them. I get to know, their lifestyle habits, because as I'll speak about later, lifestyle plays a very, very big part in our health, in our overall health. But you have to spend the time, you have to educate. Doctor is about educating, right? It's about, and if you leave that out, if you don't spend the time with these people, then their health is going to not be as good as it could if they knew more, right? So it's very important to educate and to spend the time with people and to figure out what's going on with them, so that you can explain things like enzymes and proteins and things. We're made up of proteins, right? DNA. enzymes catalyze the reactions to make our cells divide. Those proteins divide in us, right? So the more we know about, and this is all biochemistry, right? The more we know about this, the more we can keep this going, the more we can increase this function. And genetics have an important part in this. You know, we haven't talked about that yet either. But the more we know about all this, the healthier we can keep people. And the more we know what's causing these changes and these diseases and these illnesses and these symptoms, you know, at the biochemical levels.
Well, and that's where you get into. We should talk a little bit more about the genome background. That's what makes us all up as humans, right? We've got our genetic code and everything about us that creates the individual characteristics that make us all unique. But how is it that plays such an integral part in the way our body functions, the problems that we have, the predispositions we have towards certain diseases or certain responses to our environment? And how do you address that as a specific specialty that you're really good at with regard to a whole genomic background scan? I know you've done that for thousands or hundreds of patients. Tell me a little bit more why that's so important.
Well, first, there are three main factors that affect everybody's health, right? One is the genomics, is your genes, right? Your genetics. Two is the environment, right? And three is your lifestyle. Those are the three main things that influence our health, right? So if you look at genetics, right? Everybody says you can be genetically susceptible to this, right? Because of the genes your mom and dad gave you, you can be more prone to certain diseases, illnesses, conditions, right? But the main thing, and I'm telling you, the main thing that characterizes whether you get something or not, whether you come down with an illness, a disease, or anything, is your lifestyle. I'm living proof that. So my mom, my dad, and my brother have all passed away due to cardiovascular dysfunction, cardiovascular disease, right? I'm not going to let it happen to me. You know why? Because I run the tests. I want to know how I'm doing, right? Lab-wise, chemically, biochemically, right? Then I do things to take care of myself cardiovascularly, right? I don't eat bad fats. I watch out for, I don't eat a lot of sugar. I watch out for things with chemicals, excess chemicals in them, right? Anything that could hurt or make my arteries dysfunction, I try and stay away from. These are all stresses, right, on our system. Stress is the only thing that causes disease. But stress comes in three forms. Stress is structural, chemical, and emotional. When I say stress, what's the first thing most people think about, right? It's like, oh, I was stressed out today at work. I was stressed out, you know, my wife, my kids, my husband, whatever, you know. Everybody thinks about, and those are all emotional stresses. But nobody ever thinks about the biochemical stresses that come every day. The air we breathe, the water we drink, the foods we eat. Women, the makeup you slap on your body, right? Sunscreens. Everything we put on our skin gets absorbed too. So all these things that with their chemicals, these are all chemical stressors that cause biochemical dysfunction in our bodies, right? I mean, a lot, and it can be a lot worse than emotional stress.
Wow. So you covered a lot there. There's that our bodies are such complicated machines with regard to everything that's going on. You talked about stress. You talked about genome, enzymes, genome, chromosomes. Those tie together, I guess. Your genes are inside your chromosomes. Is that right? And how does that function together? Is that part of what we're talking about too? And how they impact your body?
So you're going to get, from your mom and dad, 23 pairs of chromosomes, right? From your mom, from your dad. Mm-hmm. In those pairs of chromosomes are all your specific genes, right? And there's hundreds of millions of them. And they determine how your body functions up to a certain point. So it's kind of if you have the right amino acids, so that all your genes are a sequence of proteins, right? A sequence of amino acids, I should say. And they're a series of four different amino acids that run, there are a lot of them, right? So depending on how they're paired up, there should be a normal sequence of how they're paired up. So when they're not paired up normally, they say that that's a dysfunction, right? You have a SNP, a single nucleotide polymorphism, is what they call it, right?
Of course.
So if you get a lot of these SNPs in one genetic trait, you can have more of an opportunity to come down with that illness or condition. Okay, so I know this is, I don't explain this very well, but this is all predicated by how well enzymes work in your body. So every gene that you have is focused on enzymatic reaction in your body. Okay, so just because you have SNPs in your genetics, right, then it doesn't mean you're going to necessarily come down. It just means you have more of a chance to come down with whatever that gene is related to.
Well, and then you throw in the fact that there are stressors on top of that, and when you put that together, stressors cause the failure of those, or cause these to interact differently, that causes problems. How does stress play a factor in with regard to this, and how this affects what we're all dealing with in this whole human genome and system that we have?
So there's genetics, right, and that's our proteins, right, in our nucleus of the cells, right. That's our DNA, right. That's your genes. Outside of the nucleus of the cell is what we call epigenetics. Okay, so that's what epigenetics are what causes your cells to divide and for life to continue, right? The stressors directly affect the epigenetics of everybody, right? And these are chemicals and infections and toxins and emotional stress and injuries, structural stress. All these things can affect the epigenetics of our cells, which directly affect our genes, our genetics, the nucleus of the cell, because it can keep our cells from dividing. It can make the cell so sick it doesn't divide anymore.
Wow, then you've got problems. Then you've got
that's one lifestyle.
Liver failure, heart failure, that causes different
Correct.
problems that we find as part of our function. Well, Mike, we could go on forever. We're almost through our full half hour here. A couple things I want to talk about. When you talk about the impact that you've had on the community, that's when we put on the cowboy hat. And so we appreciate what you've done, and I've known the work that you've done for so many years to help so many people. It really is neat to see somebody like yourself so dedicated to making a difference on our little planet. It is a lot that most people don't realize. When you start talking about, I throw out my fantabulous word is nucleotides. Is there such thing as a nucleotide? But you talked about chromosomes and genomes and how you scan all of that. What you're doing is really awesome. I think most people need to take a few minutes to go visit Dr. Mike. So with that, I'm going to put up on the wall for everybody here. Take a look behind us again. This is the website everybody needs to take a look at, and this will give you a lot of the incredible information that Mike has available for you. I'm going to go ahead and scan over here a little bit, but take a minute. Mike has got it put together. This is primarycarechiro.com. So I'm going to go ahead and put that up on the wall here for everybody. But take a look here. This is Dr. Mike's website. Here is his, more information for him. But I'm going to flip over real quickly. Right here, we're going to jet forward to our reviews page for Mike here. So there it is. And you can see here, 5.0 stars reviews for Mike. And I tell you, when you get that kind of response from people, you must be doing something well. You've got a great looking site. You've got a lot of great information. You give people a great location. 12401 Olive Boulevard in Creve Coeur. That phone number there, 314-485-8058. Get a hold of Dr. Mike. If you care about your health, your wellness, then Dr. Mike is somebody you should definitely take the time to spend a few minutes talking to. So with that, I'm going to take a moment here also, and we have decided that certain people are worthy of, and it's hard to put this on the show while you're sitting down, but you put this over your shoulder, Mike. But it's our honor to make you one of our community leaders. So if you would hold that up, Mike is now a official Cardinal Cowboy community leader, and somebody who is hold it up a little bit higher for you. There it is. Who's making a difference in our community and doing a lot to make an impact. So keep up the good work, Dr. Mike, because there's not a lot of people that have made the impact that I think somebody like yourself has made, and we want you to continue to do so. So we go ahead. You can set that down on the table there for us. Get a hold of Dr. Mike. You can see his information again. We've got his website up. I'll put that up on the wall behind us again here. But Dr. Mike does a great job, and that's why we wanted to have you on the show to share with everybody a little bit of your expertise. We got about a minute left here. If there was one thing you would say that people need to definitely address immediately that they don't pay attention to right now, would the first thing be to say, hey, get in and come see Dr. Mike, because you can do this scan for them, and this will give them everything about their genetic background, indicate for them the areas in their stressors that are making a difference in their body and their function of their system, and can really circumvent a lot of big problems. Is that fair to say, Mike?
That's very fair to say. Yeah, you're never too young to go get a checkup these days. I mean, it's what you should do. Like I said, you get a checkup from the dentist, you go get your car checked up. Why not get your whole body checked up?
Well, we would advocate a lot of people take the time to do that, because a little bit of prevention can save a whole lot of problems. They talk about that.
Without a doubt.
As a matter of function for our humanity. And why wouldn't you do that? If you're going to go get and we talked about this, why don't people do the routine maintenance? We dabbled with that discussion a little bit earlier, but there's some people change their oil, people go to the dentist. These are things that are impactful. You got to have a nice car that runs. Your teeth should be in order, but your body's function, the way your body is doing so much to make sure that you survive. I mean, that to me seems like it would be one of the utmost critical pieces to follow up on.
I hear it every day, Carter. I hear just people talking amongst themselves. I'll be walking by and everybody's like, "Oh, I'm just so run down. I just have no energy." I mean, that's the main thing. It's like, well, why don't you have any energy? Why don't you go get checked out? You know, you shouldn't be like that. And these are 25, 30, 35-year-old people that have no energy. It makes no sense to me. Why wouldn't you go find out what's causing that?
Crazy. Well, ladies and gentlemen, we appreciate you tuning in here. Get a hold of Dr. Mike, primarycarechiro.com, right over here in Creve Coeur, Missouri, and he does a lot to help our community. Get a hold of him and stay tuned for more on the Your Little Castle Show. All right, everybody, take care. We'll talk to you again soon. Giddy up.
I jumped all over the place, sorry.